Good morning. I'm Dr. Steve Grinstead, author of the book Freedom from Suffering, A Journey of Hope, and the developer of the Addiction-Free Pain Management System. Today I'm in Colorado Springs, Colorado for the 38th Annual Winter Symposium. And today I've asked Dr. Jerry Boriskin to talk with me for a little bit because he's a leading national expert in post-traumatic stress disorder, and I want to talk to him about how he sees that playing in with chronic pain. And Jerry, also, could you introduce yourself and tell the audience about what you presented to the participants here yesterday?
Sure. I've done work with post-traumatic stress disorder since 1979, and I've also developed an expertise and appreciation of the co-occurring problems that go along with post-traumatic stress disorder, including addictive disorders. Chronic pain is another problem that we encounter along with, in the younger veteran community, the traumatic brain injury issues. So there are many things that are connected to post-traumatic stress disorder, and yesterday in my presentation I focused mostly on what is PTSD and trying to demystify it and simplify it because it is an incredibly complex yet consistent and somewhat idiosyncratic sort of phenomenon that affects people in different ways yet in a very consistent pattern. But it confuses people who have it as well as providers. So my main presentation is trying to distill some of the core insights that I've derived with 30 years of working with this very amazing problem.
Well, from all the comments I heard yesterday, I think you were very successful because many of the participants came up and were talking about, wow, he put this in terms I really got and that I can take back and start sharing with my clients right away.
Well, thank you. That's my goal, and I'm working on material for patients as well because this is something that is not that mystical, but it is cunning and baffling, just like an addictive disorder can be.
Yeah, and what I was really touched by was your simple philosophy of the 3 S's. Would you tell us about that?
Absolutely. Thank you for reminding me that. That's a core, very simple restatement of something that should be self-evident, but patients and providers lose sight of this in their quest to try to make progress with core issues. And the 3 S's simply are sleep, safety, and sobriety. And essentially what I emphasize is that you can't make progress in your co-occurring conditions, whether it's PTSD, pain, addictive disorders, et cetera, without having those 3 fundamentals ready for you. So you've got to have quality sleep, and you have to have a sense of safety in your environment, and of course be sober.
Yeah, and I think those 3 points also are really important for the pain patients because they need that in order to have quality chronic pain management.
Definitely. Yeah, definitely. And lack of sleep, you lose hope, you lose grounding, you lose integration that we look for to help people maintain their strength. And it's a precarious balance, and people who have these extra challenges need to work harder at keeping that balance. So they need to be monitoring the basics, like are they sleeping well enough? And if not, how do they correct for that in terms of natural methods or, if necessary, appropriate pharmacological interventions? So looking at the basics is so important, and not trying to move before you have the basics well established is so vital.
And that reminds me of the principle of recovery, of keeping it simple.
Right.
So again, Jerry, thank you so much for joining me today. And I want to remind everyone that freedom from suffering is a right, but it's also a responsibility. And as a healthcare provider, I feel it's my responsibility to collaborate and network with people like Dr. Boriskin here to make sure that we deliver quality care to the people that need it the most. And signing off from Colorado Springs.